Good evening. Would you join us for the pledge?
Allegiance to the flag of the United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice for all.
Dr. Davis? Roll call. Here. Mr. Levinson? Here. Mr. Parrish?
Here.
Mr. Pitts?
Here.
Mr. Williams?
Here.
At this point, I need a motion to approve tonight's agenda.
So moved.
Second?
Second.
Second.
2 seconds.
Okay.
Dr. Davis? Yes. Mr. Levinson?
Yes.
Mr. Parrish?
Yes.
Mr. Pitts?
Yes.
Mr. Williams?
Yes.
Unless anyone has any specific questions or adjustments to any one of the meeting minutes below, I would entertain an agenda to approve all meeting minutes listed below.
I move that we approve C1, C2, C3, the meeting minutes and summary approval.
C4 as well.
Did I say C4? C4 included.
A second?
Second that?
Dr. Davis? Mr. Levinson?
Yes.
Mr. Parrish?
Yes.
Mr. Pitts?
Yes.
Mr. Williams?
Yes.
Okay, at this time, we have a couple of recognitions that we'd like to do.
The board would like to invite Jack Sirianni, Daniela Boto, and Bowie Hin to the front, if you're here. Did I say those right? These look nice. The board would like to recognize these fine students. Earlier this year, they uploaded an online project called Life in Letters to the Digital Stories for a Change project for the Family, Career, and Community Leaders of America, FCCLA. Students researched, drew up their storyboard, created a skit, which they recorded on video, and edited that video before uploading it online for consideration. The video aimed to educate and inform students about how they can choose college, factors that should be considered when choosing a college, and resources that are available during the college search. Their project, which can be found on the Fruita Monument website, was selected as one of 15 teams from across the country to progress to the second level of the FCCLA National Conference. The conference took place in Atlanta this summer, and while there, these students earned a gold medal for their online project. These students are seniors this year and are continuing their leadership in FCCLA, which now has 13 members. So the board would like to recognize and congratulate these students for their hard work that has resulted in notable and accomplishment. And Dr. Serko would also like to congratulate you, our new superintendent. Ton of Siriannis in this valley. So there isn't a ton of Siriannis.
Oh, get in there.
Testing. Oh. Technology, it's making our life easier. At this time, the board would like to invite Kennedy Cavaney, Jamie Martin, Nathaniel Doty, and Trenton Oberding. And I would like to also ask that maybe if Carol Cooper's here or Cam Wyatt come up. Are any of your students here? No? Oh, okay. All right. Well, we're glad that you're here to accept the reward on their behalf. It's certainly going to be a lot nicer than having that pie thrown in your face. At this point, earlier this year, the three students, Kennedy Cavaney, Jamie Martin, and Nathaniel Doty, and Trenton Oberding, competed in the 2018 Skills USA State Leadership and Skills Conference in Colorado Springs. The conference includes competitive events that showcase the best career and technical education students in the nation. The event occupies a space equivalent to 16 football fields with thousands of contestants and 100 separate events. Jamie Martin and Kennedy Cavaney competed in the promotional bulletin board event where judges examined displays created by students based on the annual Skills USA theme. The boards promote Skills USA, CTE, and related occupational information. Students document the development of their boards in a notebook and give an oral presentation to judges. Both students earned a gold medal in this event. Jamie also competed in the Action Skills event where students give a 5 to 7 minute demonstration of an occupational skill that a student is training for. Students use examples, experiments, displays, and practical operations to clearly explain their skills, and Jamie took home a gold medal for this event also. Nathaniel Doty and Trenton Oberding completed in the Power Equipment Technology event. This event tests students' skills and knowledge in both 2 and 4 cycle engines. Students demonstrate understanding of different aspects of engines, including drivetrains, hydraulics, and wiring schematics, and also prove their customer service skills. Nathaniel earned a silver medal for this category, and Trenton earned a gold medal. These students did an exemplary job. When students officially received their prizes a couple of weeks ago, they celebrated by throwing pies at Carol Cooper, a teacher at Career Center, and Cam Wyatt, the principal at Career Center. The Board of Education is proud to recognize these students for admirable achievements, and congratulations. Yeah, take care. At this time, I'll entertain any board reports or communication requests.
Well, I had an interesting conversation about this blue book everybody got in the mail. Last year, in the blue book, they had a bill amendment that was going in to remove slavery from our Constitution, and people didn't read the blue book, and they voted against it. So it might be in there again, so look at your blue book, but it also has stuff on Amendment 73 in here that has an error, and we'll go over that in a little bit.
Any other comments?
My only deal is we've been going out to all different schools in the district, and it's been fun. I mean, it's nice to get out with teachers and staff at their staff meetings, so I appreciate the opportunity to do that.
I as well. I appreciate the staff that visit with us and give up their time freely to come and just visit and share their thinking, their ideas with us. And I think it's always important as board members that we're out and that we're listening and trying to understand the needs that our staff have and how we can better as a board and as a district support them. So I've enjoyed that opportunity as well. Anything else? Nope. Okay, at this time, a legislative report. I think that would be you.
Not a lot happening. The delegate assembly is this weekend, which is for the Association for Colorado School Board members to, they lobby at the legislative session for bills to help out with the school districts. And go over that after that's over.
Okay. At this point, we do have an audience comment. Jeffrey Dodson. Yeah, come on up. And Jeff, if you would just state your name again and what you want to address.
Yes. Or can I stand?
Yeah, sure.
All right. My name is Reverend Jeffrey Dodson, and I just wanted to briefly address you as the Board of Education here on agenda item J1 on the Amendment 73. I'm a local faith leader and a father of 3 wonderful children. And a gathering of local faith leaders sent the Board of Education a letter encouraging you to consider endorsing the Amendment 73 and encouraging for our constituents to vote yes come Election Day. And so I just wanted to stand up here and encourage you to vote yes on that tonight and to affirm your support as a Board of Education for Amendment 73. As faith leaders, there were 11 people who signed on, 11 faith communities who sent a letter to encourage you to do that. And as faith leaders, we really do believe in the education system here in Grand Junction, District 51. We believe it's a lifeline for many of our children, and whatever we can do to support the livelihoods and the educational aspirations of our kids, you have our full support. So thank you for considering your support of Amendment 73, and thank you so much for all the hard work you do as the Board of Education and for all the teachers and auxiliary personnel out there. Thank you for the work you do for our children and our communities.
Thank you. Thank you.
Thank you.
Okay, at this time, we'll turn it over to Dr. Circo.
Great, well, I'm pleased to be here for my first board meeting. I had a great first week and a half, really, and, began to get more and more acquainted with different people across the district. Still have a lot to learn, obviously. It's kind of a steep learning curve, and making sure that I'm acquainted with those key issues and the key initiatives that we're working hard on implementing. I think what I've been most impressed with in my conversations over really the last few weeks is really just how committed everyone is to the students and the important work that we do day in and day out, and to the community and staff. And I think leadership transitions always make people a little bit nervous. That's very natural in an organization. But like I said, I think we can all be very proud that people stayed very focused on the most important things and on making sure that our students have had a very positive first quarter, which from all indicators that I have is definitely the case. I've had an opportunity to attend some professional learning pieces, some bits and pieces of them, and it's very well designed and right on target with what we need to do to promote excellent practices for our students. So very excited with what I've seen so far, knowing we have some challenges ahead to really examine different pieces. Met with a group of our leaders and designed a calendar to really, of different meetings, to really take a look at the reorganization and some of the issues that have been identified. So we have a plan of action, and we'll keep you posted on that. But the idea being that, like I said, things are going on very well across the system, but we also are prepared to deal with those difficult challenges that lie ahead, as well as the calendar. So I encourage you to attend some of the different calendar meetings that are taking place, asking for public feedback. I was at one last evening, as was Doug, and it was great feedback from a lot of people. So I know I mentioned that briefly, but I just want to do a little commercial for that. So thank you. Our first item is really the School Health Professionals Grant Program. And while Mrs. Kathy Ebel is not able to be with us tonight, she has several of her staff members who will introduce themselves and are prepared to tell us about the program.
Nothing, okay, it's okay.
Good evening. I'm Marjorie Brennan, Prevention Services Coordinator, and I am here tonight with the social workers as well as a student and a parent. Just want to start by allowing each of these lovely women to introduce themselves.
I'm Melissa Fisher.
I'm Ariel Rent-Padron.
I'm Sarah Hammond.
And Courtney Flores.
Can you all see this PowerPoint?
Yes, we can.
Okay.
And I guess the other question I would have is, are you here on, do you represent any particular building or agency or?
Yes, so we'll get to
Okay.
that in just a minute. So the school health professionals are funded by a grant that started last year and will end at the end of next year. Just want to give these ladies a moment to talk about the very essential work that they're doing in schools specific to behavioral health, so with an emphasis on mental health and wellness, as well as substance abuse, identification and referral for treatment when appropriate. So there are 4 of them, as you can see. They each split their time between a middle school and a high school. You can imagine that they are spread very thin and are doing a phenomenal job with the time that they have and the support from the admin in the schools that are listed behind you.
So we are just going to overview some of the services that we are providing within our schools. So we really are trying to hit all 3 tiers of intervention. So as our tier 1 whole school services, we are utilizing Sources of Strength, which is the evidence-based suicide prevention and resiliency program. So we are supporting our schools with getting that going and kind of boosting up schools that already have it. We are also being trained as trainers, which will support the district moving forward with implementation in other schools. We also are teaming up to support with SEL curriculum development and implementation. So we actually have developed some SEL lessons, which we have offered to our schools. We offer the teachers to use them, or we offer to go in and teach the classes for them. So in the first quarter, our lessons have been used 35 times for a total of about 2,400 students. Oh, and then Courtney will talk about our tier 2.
So another large component of our role is to run small groups as a targeted intervention for some of our students. We have listed some of the curriculums that we use up there, but they cover topics like mental health, substance use, emotion regulation, coping skills, resilience, marijuana intervention, things like that. And we are always looking for new evidence-based curriculums that we can get. And one of the great things about the grant is that it has allowed us to purchase some of those curriculums and be trained in their implementation. And last year during the spring semester, we were able to engage 132 students in groups.
And then our third and most intensive tier of intervention is individual care coordination and case management. So those are kiddos that we're checking in with individually on a regular basis. We're referring them out to treatment. Last year we referred to 9 separate community agencies. We received 354 referrals overall last year, and we were started late, so we weren't hired until September 18th, and we got into our schools October 1st. And just from October 1st through the end of the school year, we received 354 referrals in our schools. 132 of those students were engaged in groups, as Courtney said. 159 were engaged in those individual services. We also served 148 students on a walk-in basis. We did 34 suicide risk assessments last year, and we've already completed 29 suicide risk assessments just this quarter.
Wow.
We also continue to serve on our district's crisis team. All of us are crisis team leads. So we each have a team of 5 mental health professionals with us that when crises happen within the district, we respond to those and try to give support to schools that we don't even serve through that main district hub. So that's something we do as well. We have 2 people here One of them is a parent from Grand Junction High School, and the other one is a student from Bookcliff Middle, and they just wanted to share some of the work that we've been doing with them. So if you guys want to come up, Athena and Jasmine. Athena, do you want to go first, sweetie? Or do you want to go second?
Hi, my name is Athena Blazon, and Ms. Ariel has been working with me for about 2 years now, and she has helped me through a lot of living situations and trying to find me a stable and healthy environment. And she helps me calm down when I'm at school and I like go through some things, and I'm like, because like sometimes I like to punch walls and break things, and she helps me like calm down when I want to feel like when I feel suicidal or when I like want to cut, because I tend to cut a lot. And she also teaches me that drugs aren't the best choice in life, and I really haven't had that much support in my life, and Ms. Ariel has showed me that she's a person that I can trust and talk to, knowing that she'll be there and come for me when I need it. And I don't know, she's helped me through a lot.
My name is Jasmine Kennedy. I have a paper for my son, and then I wrote one on my own. My son said, Melissa Fisher has been there through me, through my rough times in middle school. She has been there when me and my mom sometimes fight, and she has been there for me. She is like my all-state agent. She is always there for me. She has been there through middle school and my transition into high school. I believe Melissa Fisher is a huge benefit for my son. My son has ADHD. He sometimes gets in trouble or gets upset. She has been there with him for the past 3 years. She has helped calm him down and is a mentor for him. She is the one person my son has came to and learned to respect. When my son got into trouble, she helped get him an outside counselor to help. She knows sports are important to him and helps keep him focused and stay out of trouble. When my son had a huge family member loss, she was really there. It took him a year to finally open up, but she got him to go to grief counseling. As a mother, my son is going to middle school. From high school, it has been easier with her there. She knows his strengths and his struggles, and it helps with the new teachers. When he played soccer this year, he made his first goal, and after it helped him win the game. And then after that, she was the first person that he had called. Melissa Fisher has helped him at times, and me at times as a mother. When I'm having a hard time, sometimes I'm not sure what to do, and I hit a wall, she is there to help guide me. She is great at what she does, and I believe her job is very important to kids and to their families.
So I don't think it's easy to come up and talk to this group, but thank you very much. It's a lot of times better stuff than something prepared, that you guys come and tell us real stuff. So thank you very much.
Yes. Appreciate your courage. It took a lot to come and look at us and share what you did. Thank you.
So in your packets, you also have a letter of support from a teacher at Central. And then we are available for questions if you have any.
Okay.
So tell me about the grant. You're in what year of the grant? Second, third?
We are in year 1.5 of
1.5?
3.
And it goes for one more?
Mm-hmm.
And then what?
That's a great question. We don't have a solution. We don't have a sustainability plan at this point.
Okay, so there's likely not another grant coming to replace this one?
Correct. We are not eligible for funding through this source, again, for this purpose.
And what does your program cost?
That's a great question. I wish I could answer that. I'm new to this position and.
Okay, I'm, part of what we get to do up here is decide a lot of stuff we had to have that is grant funded and it's very worthwhile. And so we got to figure out when we go do budget in years to come, where we're going to move money around.
So Kathy and I are working on those numbers, and they are forthcoming.
Okay, I didn't mean to put you on the spot. I'm just curious.
No.
Thank you.
One of the things that really hit me was the increase in suicide referrals. And do you attribute to the increase due to the fact that people know who you are and the support that you have and the visibility you have? Do you believe that's why you're dealing with more? I mean, we know they're there, but why are they seeking you out now?
Well, I'll share my opinion, and then I'll let the rest of the group talk. I really believe that it's a direct result of the board policy to say we are going to address this issue and we're going to pay attention. So it's a level of awareness that's increased throughout every single school, and we've created safety and acknowledgement, safe to tell. So there are avenues to report, and my belief is it's because we have decided as a district that this is important and we're going to pay attention.
I think we're also catching kiddos earlier, so a lot of those risk assessments that we've done have been lower. And just last year, since we were new to our buildings, they didn't really know us. We didn't know them in the system, and so we were trying to really fit seamlessly into the systems and the culture that the building already had. And so now that people know who we are and what we can do, they are a lot more likely to refer kids to us, and kids know who we are too. So on a walk-in basis, I find them to be more comfortable talking with me this year just because they've seen me around, and then that's kind of how things are coming up.
So you talk about your building, and I probably missed this. You each are assigned to a building?
Yes, we each have a middle school and a high school-ish. Sarah's at Fruit 8-9, so that kind of.
So you're assigned to several buildings, but you have.
Yes, we spend 3 days at our high school and 2 days at our middle school just because the populations are significantly bigger in the high school.
Terrific.
What's the networking? You talked about referrals, and one of the notes I wrote down is obviously they're student referrals because they come in self-referral. How much of that do you get from individual teachers or counselors, or where do the other bulk of referrals initiate from?
So we get most of our referrals through admin or counselors. They kind of funnel them through whatever services they're already getting, and then when they reach a certain point, or let's say they're at risk for substance use or have maybe received discipline for substance use, then we'd get them. We also get referrals through the Pathways program. So a lot of the kids that get substance referrals, they go through Pathways, and then we immediately meet with them when they get back to school and then follow up and see if they need additional support. Some of them, maybe it was a one-time thing, and so we'll check in periodically. Others, we realize there's a serious problem, and just having one intervention for a short period of time is not going to serve those needs. So we meet with them and then get them connected with outside resources that can help them more fully.
One of the things I noticed is the mom referred to the fact that there was an outside agency that became involved with the family and the young man. So obviously talk about some of the relationships or partnerships that you might have with outside agencies and how that works. How does that dovetail together?
Sure. So we do a lot of referrals in a similar way to school counselors do. They're very similar. We talk a lot with Griffith Center, Mind Springs, Second Wind Fund, which I hope you guys are aware of. They give funding for kids that are uninsured, that need access to mental health care, that are at risk for suicide. We also, like behavioral health and wellness, FAP. We've done FAP referrals, Family Adolescent Partnership. So we're lucky that our new coordinator has extensive relationships with FAP, and so she's really helped to guide that. Several of us have had different relationships. I used to work for Mind Springs. Several of us have at some point worked with Griffith, so we know people in those other agencies, and so that's kind of helped build some of those relationships as well. When we need something quickly, we can call and touch base with them, and I think that's been helpful. We have some of those branches. You want to add?
And we're all qualified to be doing therapy, but part of the grant is that we are not doing therapy with kids. So it's really important to get them to connect to those outside resources and then make that a sustainable plan too, because we're not available to support them in the summer. So I think a lot of our referrals, we're getting kids set up for summer, getting them prepared to spend like 3 months away from their support system, that kind of thing. So we just want to make sure that kids and families are well connected and having what they need outside of school.
You know, you made an interesting distinction there that you're not available in the summer just due to the nature of your contract. Would that be a benefit to have your positions be full, your contracts in maintaining that ongoing contact with students?
I think that absolutely would be beneficial.
So the number of suicide assessments seems to be escalating, but the number of actual suicides, is that going down? Mm-hmm. Which means your services are picking up more students that have severe needs, and the results are showing. So that's huge. I've noticed that in the last few years. So thank you very much. And those two girls, that was very powerful. You know, the message they have, and they need to know that is important. So.
And to answer your financial question, Kathy Ebel and I have been working on this grant-funded program and many other grant-funded programs that will be sunsetting in the future few years, a couple of years. This one cost $281,000 this year, and it's very, very valuable, as you heard.
Yeah.
Can I ask a question? So, you know, this is a topic that's near and dear to a lot of people's hearts, and I know there are a lot of efforts in the schools around mental health and mental wellness. Tell me how your program intersects with the counselors, with the mental health first aid project that's going on. I mean, you hear about a lot of different projects going on in different places, and so I was curious how you guys intersect with those, and how we could possibly, if it's not already a coordinated effort that also helps with sort of shared resources, both human and financial.
I can talk. I just don't know if someone else wants to.
So I feel like that is something that so last year was our first year. And so we were really learning, how do we function within these systems that already exist? What's our place? I feel like now going into our second year, we have a much better flow of which lanes are kind of our lanes, which parts intersect. So perfect example of signs of suicide. It's one of the suicide prevention gateway kind of trainings. I helped a counselor do that today, for instance. So we're teaming up with the counselors to do some of that stuff, the universal. We really take on the kids at risk for the substance use. That's kind of the main niche that's super different, that our kids that are dealing with substance use, we definitely take them on. We're getting them into resources, but we're also working with them with motivational interviewing, figuring out if they're in a place where they can make a change. So I think that's one huge difference. And then I think part of it is that we have a lower caseload than our counselors. So our really at high risk kids, we can kind of cut out that time for them. And that's one area where our lane has been a little bit different. But I think we're constantly in meetings with the counselors, constantly working with them, problem solving. Hey, this kid has this going on. What can we do better as a school? Going to those reentry meetings. Those are things that we're trying to do to make sure that we're all on the same page. I just think levels of risk and then some of the substance use stuff has been really different. That's where we've kind of found our niche. Do you guys?
I asked that question because we already have silos across the community with this, and everybody's doing the same thing sometimes. And you look around and you're like, wait, we should form teams around some of this. And so I wonder about the same thing happening actually in a smaller environment within the school. So you have the school psychologists, and then there's counselors, and then there are teachers who are on the front line often doing sort of from the hip kind of support and counseling. And I wondered about if the evolution of your project is to help form interdisciplinary teams so that you can really sort of leverage, again, your hours, your money, and make sure you're not doing any of the same things, but augmenting which each of you do.
Well, and foundationally, the fact that we are committed to social emotional learning and recognizing that a dysregulated child or a dysregulated adult is not going to be able to access their cortex and learn any academics. So just the awareness that this is real and that we need to address it, I really think is foundationally how all of this is going to be integrated.
And also in an effort not to work in silos, we are on our school's MTSS teams, we're on our school's RTI teams, and so we are constantly working with our counselors. Most of our referrals come from counselors so that we're not doubling up on services and we're really spreading out as much as we can. Another piece that I think we've been able to add to our schools because of our position is more prevention work. Instead of just intervention in crisis, we've been trying to step out ahead ooh, I don't know what's happening, by doing things like sources of strength in these SEL lessons, which has been really great for our schools.
It did.
Thank you very much.
Thank you.
And thank you for the work that you're doing.
Good work.
I would now like to invite Ms. Sheila Nasky and Mr. Rob Henderson to come up and talk about our employee benefits update for the 2019 benefit year.
Do I have to talk into this thing?
The other one probably works.
Okay. All right. Can you hear me? As you all know, our health insurance that's provided to employees and their dependents is via a self-funded plan that we administer within School District 51. And I am the plan administrator, but I'm certainly not alone in this. Just so that you know, as far as an update is concerned, our reserves for our self-funded health plan are quite healthy. We have not had an increase in premiums since 2015, so we're on our 4th year. We're not having any premium increases for 2019. I would pretty much guess that we're probably the only school district, if not the only business entity, that hasn't had an increase in premiums in 4 years. So we've come a long way. But in addition to that, we've also, with no premium increase, we've enhanced benefits over the years, over the last 3 years. And then we have some significant enhancements on board for 2019, including a lower deductible and then co-pays instead of people having to pay first dollar out of pocket to go to a specialist, and some other benefit enhancements, including, by the way, chiropractic services for those that think they can benefit from that. This has all been done through a team effort, and I can't thank the board enough for having guiding us and supporting us and having confidence in our ability to run our own health insurance. So the board has been significant. Phil Onofrio, my boss, who keeps me in line, very very supportive and confident. But additionally, and I'm just going to take a second here, that we have an employee insurance committee that consists of a cross-section of employees from teachers, custodians, food service workers, and they have been absolutely phenomenal in there. We've stuck together now for quite a long time, probably at least all of us, the 14 of us on this, have been together on our insurance committee for probably 6 years, if not more. But those people include Tyra Klinkingbeard, a teacher at Fruita Monument High School, Valerie Conniff, a teacher at Book Cliff Middle School, Mimi Donnelly, a technology specialist, Kara Downey in our transportation department, Trey Downey, a teacher at Central High School, Mona Hexum, a teacher at Mount Garfield Middle School, Kate Jackson, the lead custodian at Redlands Middle School, Heather O'Brien, the MBEA president, Debbie Wells-Patton in custodial services, Janice White in nutrition services, Michelle Wilcox in our HR department. And additionally, we have, of course, Rob Henderson, who is our broker consultant with Novo Benefits, and then Rachel Talley from Human Resources, who has helped us immensely, especially with respect to data, and then Siri Vinsel, my assistant risk management specialist. So that team of people, the board, we can all be very happy that we have a very successful self-funded health insurance plan that's providing medical care, health care for our employees and their dependents. So why I'm here tonight is to ask your consideration for an enhancement to our plan that is so successful, but we have this one big dark cloud that's hanging over our health plan. And I liken it to this. The other night I was at a restaurant, and as I'm walking out, there's a big sign that says, "Tell us about your experience." And it made me think, you know, I don't care how wonderful the food is. If the service is deplorable, the experience is like, I'm not coming back here. I don't care how good your food is. If I had to wait an hour for my dinner, I'm not coming back. And that's how our health plan is as far as our employees are concerned. Our insurance committee, these people are the eyes and ears out there in the ranks, and they're the ones that listen to employees and all their complaints or accolades, whatever they may be, regarding our health insurance plan. There is one big thing that keeps coming back to all of our insurance committees, and certainly I can't tell you how many calls I get in a week about this very issue, that black cloud, and it's this. The healthcare insurance experience and even the healthcare experience is maddening. So you can imagine if you had a chronic disease or worse, some significant disease like cancer or some life-threatening problem, and you're having to deal with insurance, and the insurance, we don't have an insurance company, we have a third-party administrator, but everybody perceives them as being the insurance company. But calling and lucky if you talk to a person after being on hold for 10 or 15 minutes, your question might be, well, why don't you just get a new third-party administrator? We, as John and Tom know, we did an RFI for a new third-party administrator, but the fact of the matter is, and I've been in insurance for a long time, it's the way of the world. Insurance companies are this behemoth, bureaucratic industry that they're not as people-oriented as we wish they were. So that being said, people pull their hair out, are frustrated, are in tears oftentimes calling me because of their frustration with trying to get resolution with either a claim or what do I do, how do I do it, where am I supposed to go, do I have to get pre-authorization, just a plethora of problems and questions that people have when they're faced with a healthcare crisis or even a routine healthcare situation. So with that being said, the insurance committee said we've got to do something. We've got to do something. And so that's what brings me here tonight, along with Rob, is we do sincerely believe that we have a solution that not only benefits the plan financially, it costs us, but we'll get a return on investment. It's going to cost the plan, but more importantly, in my perspective, it's going to help employees and their family members to where they do not have to deal with whatever TPA it is. Right now we have UMR, but it wouldn't matter whether it was Aetna, Cigna. A TPA is a TPA is a TPA is when it comes to how things are handled. So
You're saying they're all the same?
I'm pretty much saying they're all the same.
You said to do another RFP, but no matter who you pick, you're saying the quality of service will be just, you expect it to be just what we're getting now?
Well, I think that there are certainly TPAs that offer a better customer service, but we want to take it to the next level. thanks to you guys, the board, we've taken some risks that have been proven successful with our health plan. And that's what we're asking again is let's take a risk here and take this to the next level. Yeah, we can get some customer service, but what we're going to be asking you to consider is a entity called Quantum Health that entails much more than customer service. It's managed healthcare, because we all get lost in the healthcare world, except for maybe you, Dr. Davis, but the rest of us don't know, what if the doctor says go get an MRI, I go get an MRI. If, it's what's done is done. And so many times, unbeknownst to the providers, there's a duplication of services. So I had an MRI here, but now this doctor that I've been referred to, he wants an MRI, so I get another MRI. That's an expense, to the plan. So I'll let Rob talk about it in more detail as far as what's meant by managed care, but it's to benefit our plan, and more importantly, it's to benefit our employees. They're not only with respect to their health care, but to their sanity when having to deal with health insurance. They won't have to talk to UMR. They won't have to talk to an insurance person. What we want them to have is, what we're asking for is essentially a health care warrior for our employees and their family members, so that somebody's out there fighting the fight for them and getting things done in their health care. So that being said, I'm going to turn it over to Rob so he can explain a little bit more as to what I'm talking about.
Thank you, Sheila. Can you hear okay? Any questions before I move on? Okay.
I guess the one question might be for the audience, Rob, is what we're talking about is not a healthcare provider, but someone that acts in benefit between the employee and the healthcare provider.
That's correct. Really, in all access points to the healthcare system, and Mr. Levinson, your question is very valid. When you look at what Quantum Health does, it really solves for not just customer service. So it does that, yes, but it really, in many respects, solves for the broken healthcare system in many regards. And I think I probably could throw a question out to the board members in the audience. Have you ever had an access to the healthcare system where you were confused about what benefit you have, or if you have a claim question, you call customer service and you're frustrated by the service that you get, or they're not able to answer your question, or they don't understand what the problem is. The healthcare system today is very, very complex. It has very difficult access points in terms of a member's ability to navigate that on their own. And as Sheila said, it's a great example. If you've got an individual that has a very bad healthcare condition, let's say they've just been diagnosed with cancer, their mindset isn't, okay, let me get my plan of benefits out and see where I'm supposed to go and see how I'm supposed to use my benefits the best. And by the way, who provides the lowest cost of care or the best outcomes for this? Their mindset is, oh my gosh, I have got a very serious problem here. Who's going to help me? And the fact of the matter is, in our system today, there really isn't someone there to help them. Oftentimes, that's Sheila Naskey. In your world today, Sheila is the healthcare warrior for your employees today and their families.
And did I mention that I'm retired?
So there's a window there that we get to keep Sheila in that position. But it really, Quantum Health is a program that's called Care Coordination and Navigation. So if you think of it in terms of kind of two separate ways of dealing with a member, where their job is to interact with a member who is interfacing with the healthcare system and subsequently health insurance, to help them through that entire encounter as though, as Sheila said, they're the healthcare warrior. So the nature of customer service in insurance today is very transactional. A member, after the fact, after they've already been to see the doctor, they've already perhaps been through and used their benefits, perhaps they've gotten a surgery, they've already experienced services in the healthcare world, and now they've got questions about their benefit or questions about their bill. And then they call the health insurance company, and the nature of that call is very transactional. Hello, is this Mr. Levinson from District 51? Yes, okay, what can I do for you? it's very transactional in terms of trying to help you through something that's already occurred in your world. And it's already confusing for you in this, from the perspective of you get balanced bill from a provider. Why did I get this bill when I've got insurance? I don't understand why those two things shouldn't be happening at the same time. So the transactional nature of customer service today in the insurance world is such that their job is to kind of get your question answered and get you off the phone. It's what's called first call resolution in the health insurance world. So it's a very transactional interaction between members and the health insurance world. Get you off the phone, get your question answered. The typical call time for a TPA in customer service is 90 seconds. And that's where Sheila was saying a TPA is a TPA. They're all the same in that regard. You can have a TPA that gives very good customer service and maybe they give very good correct answers. But their job is to get that done in 90 seconds and get you off the phone because it's a production environment. With Quantum Health, the environment is very different because they're interfacing with those members well upstream of when you even use your benefit. So before you're even potentially even seeing a primary care provider for whatever ailment you may have, they may call Quantum Health, that member, the District 51 insured member may call Quantum and say, I understand you're just an advocate for me and you're here to help me. My knee hurts and I'm going to go see the doctor. What should I be asking them? So all the way upstream where they're actually interfacing with this healthcare system, they've got somebody who's there with them the entire way. And I'll ask Dr. Davis, have you ever had somebody come in to your office and say, my knee hurts, but I know what's wrong with me, I Googled it? That never happens, never happens. Are they ever right? They do that. Sometimes they are. Sometimes they come in very educated, but then sometimes their self-diagnosis results in the wrong direction. Like 60% of the time when people self-diagnose, they're down the wrong path. They go see specialists, they're seeing an orthopedic surgeon before they even know whether their knee needs surgery. The kind of assistance and support that somebody needs to navigate the entire healthcare system today is very, very different than it was maybe years ago. So Quantum Health is in the business of care coordination. So on the front end, before somebody even has a claim, which is on the back end of the whole experience, when they're already confused about what's happened, their job is to interact with them through the entire process of a healthcare experience or a healthcare journey. And again, perhaps it's that worst case scenario of they've gotten diagnosed with cancer. What do they do now? What's their first step? So today, we give an employee an employee benefits card and kind of turn them loose. They've got their benefit plan design, they've got their benefits card, they've got a network. They may know who their primary care physician is, maybe they don't even have one. They need help at that point of accessing the healthcare system for two reasons. One, to get them through that experience in a way that gets them the best possible outcome where they're satisfied with the experience that they've had. So again, there's kind of two sides of this. There's the customer service side or the navigation part of care coordination and navigation. But there's also the care coordination piece where it enables them to better access the healthcare system to get them through that experience in the best possible way and have someone there with them the entire time versus just kind of cutting them loose and having them fend for themselves, which is not just the environment in UMR, it's the environment in healthcare today. Now, insurance companies and, frankly, hospitals and providers are all scrambling to try and figure out how to do this. One of the good things that happened with the Affordable Care Act is a thing called ACOs, or Accountable Care Organizations, where hospitals are being tasked with, primarily on Medicare and Medicaid, being tasked with doing a better job of caring for individuals in sort of that holistic approach. But there's really nothing in the insurance world where, for District 51 and the board, where you're really delivering a health insurance product for your members to use. And I say members, your employed folks as well as their dependents that they cover. That's a product that you're delivering to them. And in using that product, as Sheila said, oftentimes when they come out of that, they have not had the best experience. I mean, we've heard some honestly heartbreaking stories about a member who's dependent, had cancer, and she took a day off work and spent 4 hours on the phone chasing after what to do next. And that's not something you want to hear in an environment where your benefits are very good. Your program is actually an excellent program. And if you don't know how all of it works, because it's a little complex in terms of how all the pieces and parts work together, I encourage you to interact with us and your benefits team to learn more about that. But you have an industry-leading program in terms of what companies are doing nationally It's interesting because when we see what other folks are doing nationally, and they're coming out with these, oh, great, new innovative programs, we look at that and say, well, District 51 has been doing that for years. You have a very good program. Unfortunately, as Sheila said, there's sort of a black cloud over the way that people access health care generally and the way they're treated throughout the customer service process in terms of how somebody who perhaps knows the system very well, it's Dr. Davis, I'm assuming you do, I do, and even when I have a health claim and have to call my insurance company, which happens to be Cigna, it is confounding. Quantum Health is there to solve that issue. They solve for a number of scenarios, not just the customer service and not just having people come out the other end feeling like, that was a great experience. I actually had them help me through the entire process, and I'm happy with the way that worked. The customer service score for Quantum Health in the NPS, the Net Promoter Score, which is nationally, that's what a lot of companies are using to determine the level of their services. Quantum Health has an NPS score of 74 with members. Nordstrom's is about an 80. The health insurance industry generally is about an 18. So that's where you're at generally with your customer satisfaction scores for the healthcare world today. Not just your TPA, but that's the way that folks feel about healthcare generally and health insurance generally. Quantum Health has increased the customer satisfaction for members to a 74 in their program. So
I'm very gently, as the time police kind of ask you to summarize, just so we know that the board has plenty of time to ask questions.
thank you for that.
So just
You can tell I'm passionate about, about what I do in the experience. Quantum Health, the other companies that you might recognize that have taken this on, Honda Motor Corp, Teva, iHeartMedia, Hertz Motor Corporation, AutoNation in the school world, Hancock County School Consortium, New Jersey Education Association, Wisconsin Association of Independent Colleges and Universities. So many other educational institutions have taken on this program as getting their health care programs to the next level. I'll cut quickly to this program is an adjunct to UMR. So this is not something that is a sort of quote-unquote a product, is somewhat of a bolt-on in that we paired that up with UMR. Anthem was part of the RFI. They responded with their own program called Anthem Health Guide. So there are others out there doing this. But in terms of what Quantum Health does, they're the only one it's kind of a standalone that pairs with the vendors so that if you were to elect to go forward with the negotiation with Quantum Health, if you were to change TPAs at some point down the road, you don't have to change Quantum. So it's an overlay to the existing program. It integrates completely with the TPA, with your benefit plan design, with your current programs, and I would say with any future programs that you would want to look at, this will integrate with all of those programs. The cost of the program, to introduce the cost of the program? The cost of the program, there's a net and a gross. The gross of that is $437,000. So it's not inexpensive to deliver this kind of service to your employees and to your members. But the anticipated savings generated from the program, and this is actuarially validated in several forms, $764,000 is the expected first-year savings. So the net to that, the net program cost about $326,000 in savings for the school district. So on a net basis, there's not a real cost in that it pays for itself through the savings that it generates, but there is a bill at the end of the day, and that's the $437,000. To give you an idea of how that compares, the Anthem product that would be a kind of a comparable to this that was bid in the RFI was about $1.5 million for Anthem and their care coordination solution. UMR with Quantum is about $1.3 million. So from a competitive standpoint, it was negotiated competitively. Nova Benefits on your behalf has already negotiated out $130,000 of cost. So the $437,000 has already been reduced by $130,000 based on our negotiations with them. Quantum normally charges about a $70,000 implementation fee, which we got waived on your behalf. So it's already been negotiated from that standpoint. And to be respectful of time, questions?
So is this already going, or will you need a decision from the board tonight?
We're asking for a resolution from the board to move forward with this, with pursuing a contract with Quantum Health to provide their services for the 2019 benefit year. I'd like to roll it out in January to get as big a bang for the buck as we possibly can, starting with the new benefit year. So,
Were there other companies that provide the similar service that we looked at with Quantum?
Yeah, there are other companies in this space. This is the only one that integrates in the levels that I've talked about in terms of integrating with your program specifically. So they've looked at all aspects of how your rather complex system works and are able to integrate. Some of the others in the business, frankly, don't do the care coordination piece. They might do the advocacy part of it, but not the whole-scale approach that Quantum does. So in some ways, they're again, Anthem's program is similar, but again, you would have to be with Anthem to have that program. This is the only one that will overlay, and you can move within it.
I got to be part of that interview process of the two RFIs, and Quantum was impressive. So it was an interesting day for me.
Oh, I have a couple questions. And bear with me, because I may have expertise in primary care, but not health insurance. It's a confusing world. So I was curious, if there's all this savings with an overlay like Quantum, why don't all insurance companies do this so that they save their money, that they save their consumers money?
It's a great question. They are beginning to. Many companies nationally. Anthem Blue Cross is one that is of note, that most of the Anthem plans around the country are doing something. The interesting thing is there's a difference when you're an insurance company who's used to that transactional world and you try and shift gears and become this very high-touch advocacy. It doesn't translate as well. They have a hard time being what Quantum is. And Quantum's been doing this for 19 years successfully. So they were the innovator and the leader in this space. Health insurance
you could either contract that out if you were a big insurance company, or you could try to develop a concierge service within your organization. So it's curious to me that this is like some novel thing, and I when I heard about it, it sounds great, but I'm always suspicious that whatever sounds great is, you wonder what's under the bed, right? So I got to thinking, well, why don't all plans do this? And if it saves that much money, why don't plans build concierge services in to do exactly what Quantum does, or why don't they just contract with Quantum and then have someone else do it and get $400,000 in savings?
I believe Quantum actually does contract with insurance carriers. I can't name them, but I know that is part of their market space. Anthem would be, again, a good example, and I bring them up because we look very closely at them with their Anthem Health Guide program. So they tried to emulate Quantum, and like the big carriers, sometimes they want to build their own rather than buy it from somebody. It is expensive, as you can see. Insurance companies are more about the bottom line, so if they can do without and have a better bottom line. But I think what they're finding is most of the big insurance companies are trying to build their own programs like this because they see what's happening in the ACO world and are really having to follow suit with that. It's hard to get out of that transactional mindset into a mindset where they're actually having to build out significant resources to apply to this. There's a doubling and redoubling of customer service resources in an environment like this.
Right. So we have so school districts tend to be younger, healthier people, I think, when you look at people who are teachers. I guess maybe that's too much of a generalization, but you talked about the actuarial data. So does an organization like Quantum charge a per person based on sort of a health demographic that we've provided for them about what our people look like, or is it the same for us as opposed to IBM, as opposed to wherever? How does that get determined, how much they charge us?
There is an underwriting, so to speak. It's a per member per month.
Correct.
So PM. So not so much employees. You've got about 2,200 employees on the plan, about 3,300 members. So their fee is $11.04, I think, per member per month. That's what totals up to the number I gave you. And because you've got fewer members per employee than most companies, your fee is actually less than they would charge for most companies. But there is a demographic aspect of that. How many singles do you have? How many males and females and average ages and such? So that's all been rated in to their fee structure. Mm-hmm. Did that answer your question?
Yeah, a little bit. I was just, obviously, this is a company that is for-profit and wants to make some money, and so the question is, why would they want to do this? Well, obviously, there's advantage in their collecting the per member per month payments, and then our advantage is presumably down the road having better satisfaction and better outcomes is sort of the ideal. But if you have a sick population versus a healthy population, then it's not a huge savings to us if we have healthy people who don't need the services versus a sick population of people who need the services. And then that's why I wondered about our specific demographic and, do we have sick enough folks where that makes that difference?
Well, we vetted that in a couple of ways, Dr. Davis. The stop-loss carrier has underwriters that forecast your costs, and those are, again, actuarial bases. They estimated the net savings to be about $100,000.
Based on usage from last year and how people used healthcare services?
And more than that, just the analysis of Quantum and the impact of Quantum Health historically across their book of business, so their experience with Quantum Health. So your stop-loss renewal, inclusive of the Quantum fees, is $100,000 less. So again, the program basically pays for itself. Milliman applies a 5%, so you can say your claims times 5% is what Milliman, which is one of the larger, more recognized actuarial firms. There's a firm called McCarthy that actually reviewed Milliman's results, and they come out with a 4% impact for Quantum Health. So it's very well validated in terms of the impact. You're absolutely right, and one of the things that I'll point out is because your program runs really well, it's a really effective program at controlling cost already. You might look at that and say, well, but do we really need that because our plan is really already running so well? But there are aspects of medical trend. Specialty medications are one of the largest cost increasing items. Trend on specialty is just crazy. And you're talking about drugs that are hundreds of thousands of dollars a year. Quantum Health is one of the solutions that addresses that and helps members navigate the specialty medication piece. And they do that with providers, just so that you know. Their conversations are with members. They're also with the doctors and providers specifically so that there's more a team approach to that member's care so that everybody's kind of on the same team with getting the best possible results. So yes, your program runs really well as is. You could say that, is the 5% Milliman actuarial number going to apply to you? I don't know at the end of the day, but they've got a lot of years in vetting it.
It's a year contract?
Pardon?
It's a year contract?
The Quantum Health is a 3-year term, so the contract goes year 1, year 2, year 3.
Right.
It is a contract this is not something you would want to do just 1 year. It's
Well, no, the only reason, I'm remedial, I'm sorry, but the reason I ask is if we're going to pay $400,000 and we want to trend whether we're going to actually regain that and at what pace, I was just curious about how that worked, and if we're not regaining it, when do we get out of it?
That's a great point. In their contract, actually, in the 3-year term, there's verbiage in there that says if it doesn't prove out, that's one of the termination clauses that you can get back.
We have an opt-out clause.
Yes,
I got a quick question. Your customer service is not necessarily saving money; it's just customer satisfaction through that. But you'd mentioned some of those savings that generate that savings you were talking about. The duplication of services is minimized to one service provided instead of duplicating it. The lowest cost for that service, they have a pool where they find the best and lowest cost, and that would all be within network. Mm-hmm. And then, and I had brought this up before, but they'd even fix coding errors if upon request by the patient. Are there other ways that create that savings that you talked about, or is that it? Just those?
There are there are many, many more that are.
Some of the main ones.
Well, engaging the member with their health care, and by that I mean I call up and about my deductible or whatever, and they asked me when, hey, what, by the way, this team, I should say, it's not this big company, Quantum, and you know, it's whoever. A specific pod, that's what they call it, a pod. But a specific pod of people, a team of people are dedicated to School District 51 employees and their family members that are on our plan. So if I call UMR today and I call UMR tomorrow, the odds of me getting the same person are probably 1 in 1,000. But when I call Quantum about, hey, is this covered, or what's my deductible, or you know, whatever the question is, and I talk to Sherry, then the next week when I call back, I talk to Sherry. Sherry and I, you know, now we're, you know, she can build an engagement there. And this is just an example. Sheila, when's the last time you got your annual physical? You know, it was a couple of years ago. You know, you need to, at your age, Sheila, you need to do it. So, but, you know, they engage, and then just other things as far as their medications and following the doctor's recommendations.
So preventative savings.
Pardon me?
Yep. Okay.
Yeah.
Preventative.
Preventatively, yeah. Because that's kind of the nexus of our whole plan. We have a real hard time controlling what the cost of a specialty drug is or what an MRI costs. So how do you fight that? Preventatively and building a culture of wellness, and that's part and parcel of what my dream has been as far as our health plan. I can't control medical costs in terms of how much things cost. But boy, if we can prevent it, and if we can, you know, build a culture of wellness and prevention, then that's more than half the battle right there. So, and that's what I envision, and that's what I know that Quantum will contribute to that wellness, that culture of wellness immensely.
Oh, thank you.
So what do we do with the resolution? Is that down in the business items, or?
It's not in there.
There is no resolution.
Yeah, I think at this point, I think they just need a verbal okay to proceed.
I heard
Would that be true?
resolution, I didn't know, so.
Well, I don't know, you know, I don't
That's-
know the formalities. but just-
It's a services contract, so Dr. Circle or I could sign it per board policy. So we'd just like direction to go ahead and sign the contract when they get it available.
How does that work when, you know, we're not a pay-it-forward society, really, but, so we're going to put some money into something, hoping that we have a good return, and we have a given budget, so just, you know, indulge me. How does that work when that's $400,000 that we hadn't intended to pay with a potential payback over 1 to 3 years? How does that work in a budget when we have a fixed budget with fixed line item?
It's out of Fund 62, which is totally different from the general fund. We have our own Fund 62 is purely health insurance.
Okay.
And all the, you know, the.
Was this out of your
costs
reserve?
and the other things that go with it. So that's why I'm saying we have a reserve balance that would certainly pay for this. Then we want to return on our investment.
Right.
But we're not asking for funds from the district.
Coming from your, okay.
We're going to pay for it out of our own funds that we've been able to accumulate.
And what happens if if 3 people go on dialysis this year? Then you don't have that reserve, right?
Yeah, oh yeah, we've got the reserves.
So even with unintended big health expenditures, if you got some really sick people that can really do a number, even using this money wouldn't affect that in a negative way, so that would still be available to the self-funded plan.
We have several stopgaps. The first one is stop loss, so if we have a really, really sick person, the stop loss people pay the bill.
Okay.
The second stopgap we have is $6 million reserve, which is really pretty healthy. That's about close to half of our annual expenses. And the third stopgap is actually the general fund. But we're a long ways from getting to the general fund.
Okay, thanks.
Represent a reinvestment of reserves back into the health plan for something that will help members and return investment to make the reserves stronger yet. So,
Great. Thank you for.
I guess basically based on comments I've heard from the board, I don't sense any hesitation saying that we should move ahead with this opportunity. Would that be a fair assessment?
I think it's fair. Good.
Okay, and I think in fairness, I've challenged both these individuals to tell our story in written form. I think oftentimes as a school district, we do a lot of good things that people don't know about. And I'm particularly thinking of taxpayers in the community that think that sometimes we aren't as thrifty or wise. And I think we've done an excellent job with our health care over the years. And I think it's important we tell the story. So I'm waiting to see that article. Okay.
One last question. If your reserve hits 8 million, are you going to drop the premiums?
You know, actually, we did have a reduction. I said we haven't had an increase in premiums since 2015. Actually, in 2016, we reduced the premiums for children and families. So we actually reduced it. Will there be a reduction in premiums? No, not in this lifetime.
Well, the bigger issue is the reduction in deductibles, is what I hear. That's the complaint I hear, is that the deductibles are difficult.
And we've reduced that for 2019, and we've made it a lot more accessible. But yeah, I don't think we're going to see a reduction in premiums. So good try, Paul.
Thank you.
Doesn't hurt to ask. Thank you.
Thank you.
Ready to keep going? Does the board need a break or anything? Are you ready to go on?
You want to take a quick break? Okay, we'll reconvene at 7:30.
Okay.
It doesn't hurt to ask.
Okay, we're going to go ahead and reconvene at this time. Go ahead.
Okay, I am excited to invite our next group forward. I'm excited to invite Mrs. Marla Oppenheim. I should have asked you ahead of time. I thought about that. To talk about the Schoolwork Alliance Program, SWAP.
Thanks for your patience.
Thank you. So can you hear me or do I need to use the mic?
Terrific. Go and use the mic.
This one?
Yeah, use the mics and introduce everybody.
Okay. Is it on? Oh.
It's on.
All right, so yes, I'm Marla Oppenheim, the Director of Student Services. And with me tonight is some of our SWAP team. We're missing Julie Lovato, one of our SWAP specialists. But Donna Whetstone is our SWAP coordinator. And Tammy Gribble is one of our SWAP specialists. And Kay Hal Martinez is another SWAP specialist. They're going to talk a little bit. They'll tell you which schools they represent in a little bit. And Lisa Melchior is our high school special ed coordinator who also works with the SWAP team. So you should have got a packet, I think, of papers a little bit about SWAP before this. But SWAP is stands for School to Work. School to Work. Alliance program, and it's a partnership between the Division of Voc Rehab and the Colorado School Districts, which is supported by Colorado Department of Education. We've had SWAP in this district for 19 years. It was one of the first sites developed in Colorado. And just recently, on October 2nd, we had a site review by CDE, and they recognized our SWAP program as a model site for the district. So here to talk a little bit tonight, we have the SWAP team to talk a little bit about that and some of the success stories, and then Lisa's going to talk a little bit about how that relates to the high schools.
Hi, I think this one works. I like this one better. I sound like Elvis. So the SWAP program's been here since 1999, and I was one of the first ones hired, so kind of getting old and getting up there, but not as old as Sheila Naskey. But we run a program that's an incredible opportunity for youth. We work with kids 15 to 24, and we are there to help kids with mild to moderate barriers to employment become taxpayers. Our elevator speech is, we make taxpayers. We can help with training costs, and we actually have several programs that help pay wages. So we've had a lot of kids out there working, and with the Division of Voc Rehab, we pay their wages. So it's just an incredible opportunity for the youth in our school. Tammy's going to speak briefly about the schools that we're involved with. Kay will speak about how our interaction with the community. But we have a really quick video to show you that was compiled with some of our clients and other agencies. And Kay is going to start that.
SWAP has given me the fundamentals and the help I needed to create a career that will mold the rest of my life.
SWAP has been a wonderful program for our high school because essentially Grand Junction High School is a small city. We have all kinds of different students, and they all have different needs. Not everybody is meant to go to a four-year school. A four-year college or a traditional experience. And so SWAP has been a wonderful resource for us to help those students who are more on a career path.
With SWAP and the success and the motivation that they gave me and the drive to tell everyone that I can do this and I can make my challenge happen.
What we really like about having them part of the program is they're very much eager to learn and like to experience different duties while they're at the restore.
The cosmetologist hairstylist, that seemed like the most fun, most interactive. Helping me pick a school that would be best suited for me.
Part of the SWAP program, and I worked in a greenhouse for several months through it, and I think you've taught me really, really great work skills. and some really, really good experience too that I can refer to if I later down on the road to get a job that I want.
I became a volunteer at the Sheriff's Department for 2 years, which also gave me a leverage into the doorway with the Sheriff's Department.
St. Mary's Volunteer Program takes great value in our student population. So our SWAP students are included in that concept. We want to build a relationship with them and developing skills that they're going to take with them as they move through life.
SWAP has been very helpful for the past few years. I've been working with them since my freshman year, I believe, when I decided to take Career Center.
I work at Fortney Refrigeration. SWAP got me into a position I would have never otherwise been able to.
So SWAP very thankfully helped me find this job. I live just right down the road, and very thankfully I have a really good manager here. She's very understanding, very calm.
SWAP has helped me in many ways. They've helped me learn a job experience that I've never done before.
My first job that I got with SWAP was with a greenhouse.
From SWAP, for a long-term work skill, I've learned to interact with people better, and that kind of helped me get into the job world and kind of see a little picture of what it actually is.
Horticulture last year, and now I'm taking culinary so I can learn how to cook for myself and for other people.
I am now in a position for a permanent job outside of SWAP with this company because of the apprenticeship I was given. So I'm really grateful for everything they have set me up with.
It is. That's a good video, isn't it? That John, he is something else. So we have a contract. We serve 158 kids a year. Half of those are out of school and half are in school. It's a match fund program. Again, it's been around for 19 years, so it's been here a while. And we're integrated in all of the schools. So Tammy will tell you a little bit about how that works.
I've been asked just to briefly give you an overview of how we integrate into the high schools. We work with students 15 all the way up to young adults up to age 24. Each of the SWAP specialists, including our coordinator, are assigned to a specific high school. And then Donna also works with all of the alternative schools in addition to Palisade High School. So we work really on a one-on-one basis with the administration and the SPED department at each of the high schools. We try to work on a referral basis from the SPED departments. So we work really closely with those teachers that are kind of in the trenches with these students, letting us know which ones are mature enough, interested, to be able to be a part of this program. And we also work at their school directly. So we spend a lot of time at our high schools as well as with our students at the Career Center. So that's, briefly, that's kind of how we integrate into the schools.
Thank you, Tammy. And Kay-Hat.
So I'm going to speak about some of the outreach activities that we've had going on this year. We're really fortunate to be housed at the Career Center, so we have that unique opportunity to really partner local businesses with a pool of qualified students. Some of the activities that we have offered this year are mini job fairs with local industry, which we've had great turnouts for that. We've had Walmart, Reynolds Palmer. We partnered with the Workforce Center for the Job Fest. We partnered with CFI for their resource fair. So lots of that going on this year. In an effort to be conscientious about time, I know that you guys are coming to the Career Center. So I would invite you guys to come into our office and sit down with us and really visit with us about the wonderful things that we're doing in the school district. We're also in the classroom teaching job readiness training. So another way we partner with industry is we have an advisory board, which is comprised of about 30 local businesses. It provides a great opportunity for us to gather feedback on labor market trends, which we in turn share with CAM. And then we develop our job readiness training based on what we hear from employers. So we have the next 3 Mondays, we've got Dress for Success, mock interviews with local employers, and we try to provide a resource to kids that are looking for opportunities for work. So we also have internships that we pay for. St. Mary's on the video there has been a great partnership for us. We've got a lot of young people interested in the medical field. So we're really fortunate to live in this community because they embrace our program.
So as you've heard, these ladies work really hard to meet the needs of our students. They have built some really strong relationships in our high schools with our teachers and our students, and so our teachers feel really confident when they give them a referral that these ladies are going to do whatever they can to help those students. So it's a really, really good thing.
Thank you. Do you have any questions?
How many students do you work with on an average during a school year?
With the Division of Oak Rehab, we have to do progress notes, and every month we have to turn in a monthly report. And we typically have 100 to 110 on there. So we may just briefly be with them, or they may be in classes, but it runs about 100 a month. Yeah. And that can be brief, or it can be really in depth, where we take them out job hunting and visiting with employers.
You're making a big impact on kids' lives, and you can just tell watching that video that they have hope for their future because of the connections that you placed in their hands there. So,
thank you.
Do you have a waiting line for kids that can participate, or do you?
No, it actually isn't set up on a waiting line or a waiting list. We typically focus on juniors and seniors, but we can go down to 15. But we find, of course, that they're not usually ready for employment. The Division of Oak Rehab really partners with us. So each of us have a DVR counselor that is assigned to the school. So we have one that goes to Palisade. We have a DVR counselor that goes to Grand Junction High School. So we bring those kids to DVR, and that's how we're counted. That's our numbers, is who we actually introduce to DVR. So we don't have a waiting list because we kind of work with them and through it until they get ready to get a job.
and how do you transport these kids to their work sites, or are they on their own, or?
No, fortunately, within our contract, within our grant money, we do have a vehicle, so we can at least help with the job hunting and the outreach. And then Division of Oak Rehab can buy bus passes, and once the kids get a job, they can buy a bus pass, a GVT pass.
And then, can you talk, or maybe you did and I missed it, about how you get your referrals for the kids that are out of school?
We really partner with the Workforce Center, and so we've worked with WIOA. I'm not sure if you're familiar with that, but that's a program through the Labor Department. So we work with that program. We work with Center of Independence, although we just really, and we have a lot of siblings that will, parents will remember us and send in siblings and.
Our advisory board, and then also like primary care partners, they're working with youth, so oftentimes they're aware of their diagnosis, and so they will refer students to us that way as well.
Marla, most of the funding for this program is what, reimbursed costs, or are they grants, or Fund 10 dollars?
So it used to be a grant, and now it's a contract, but it's matched funds. So I think that we looked at the budget, it's about $451,000, but half of that was through the contract, and then the other half is matched to us.
Okay.
So our office space and our just usage of the school district, there's personnel pieces that are come out of there, psychologists. So I think you may be familiar with it too, huh? But it's matched.
So it's in kind.
In kind, yes. Okay. Mm-hmm. There's 47 swap sites in the state of Colorado right now. And Oregon is the only one, I think, that has a similar program.
Congratulations.
But we're the #1 in the site, just
It
so
is, and you should have heard CDE just go on about these ladies and everything that they've done in this program. So it was like the proud mom sitting here just listening to us. It was great. So.
Well, thank you for sharing your success with us.
Thank you.
Absolutely.
We look forward to seeing you, and we have brochures on the back.
Okay.
To hire a kid.
All right, I'd like to introduce Miss Melanie Heath and Mrs. Vi Crawford to come up and share with us the business investment financials, please.
Good evening, Board. So tonight, we don't have a formal presentation or any resolutions that we're asking you to adopt. It's more of just sharing our financial statements. So in your packets, you have 2 full sets. One is for fourth quarter of last year, 17-18, our end-of-year financials. Those are unaudited numbers, but they're pretty well finalized, I think, on our end. And then the first quarter financials, which go through September 30th. We had a chance last week to review these with our Fiscal Oversight Committee, as we usually do, and they've prepared the memo. That's the first page in your packets. We just want to go over a few of the things that they highlighted in that memo, specifically with the end-of-year statements. So in our general fund, which is our main operating fund, where the majority of our transactions happen and expenses, we ended the year about where we were projected to. So we were projecting a fund balance usage of around $200,000. It was $253,000. So pretty dang close to what we thought. One of the items that came in better than anticipated was specific ownership, and that was something that I think we were noticing even throughout the year, was that specific ownership taxes are up, which is really great. So that shows that our community, our economy is improving. People are going out and making purchases of vehicles, recreational vehicles, and paying the taxes on those. So that's a specific line item that we'll continue to monitor and see if any adjustments are needed going into readopted this year as well. The other thing that was noted in here on your first quarter statements is that revenues are slightly below where they were last year in the general fund, but that's mostly a timing issue. So we still fully anticipate receiving all of our revenues that we had budgeted. Last time before September 30th, we had received part of our special ed funding from the state, and this year we hadn't as of September 30th. So we fully anticipate to get that. That's just why that's trending slightly behind. Obviously, it's very early in our year. We continue to monitor all of our revenues and expenditures, as we always do, and make any adjustments. The main thing we're looking forward to now is our October count and learning what those official numbers will be. So, I don't know if you've had time to look through your packets and review those statements in depth. Hopefully, if you haven't, you will take the time to do so. We also publish those on our transparency page on the district homepage. So if you guys have any questions on anything that you have reviewed, we'd be happy to answer those.
Are there any indications on where we may be with student count?
It's very early still with the numbers. We think that charters are relatively flat, which is a difference from previous years where the charter schools have grown. And we think that we might be slightly up, maybe 20, 30 students within the general fund funding.
The one thing I noticed that it said that, let me find it here, salary expenditures were less. Why would that be?
For last year.
Yeah.
So they were just slightly less than budget. That's a variety of factors. So we budget for people that were in the position the year prior going into the next year, and so a lot of that is just attrition.
Okay.
People not being in those positions.
What salaries
for 4
are
years.
less?
It just said salary expenditures. So basically, from prior years, somebody may have been in the system for 30 years, and a new teacher takes the position, and so obviously we're paying the new teacher less than we
So we
paid.
do factor attrition into our budget and try to offset that. It is just a calculation, and so as people come and go throughout the year and are replaced by different people, there's always that
Okay.
difference.
So it's just a function of, you said,
Yep,
attrition.
and we try to budget pretty conservatively, especially in our salary and benefits where they do make up the bulk of our budget. So we want to always make sure that we have plenty in there.
What is the percentage of our budget that goes to salaries?
That's about 80%.
80%.
I was funny, I heard Diane Schwenke on television talk about how 55% of all school budgets goes to admin and not to the classroom, and I have no idea, and I think, I don't know where, I don't think it's a local statistic, but I have no idea where she pulled that out, but it was in a piece, anti-73, so I don't mean put Diane on the spot, I should ask her, but that's got any relevance to what we do?
I guess
I had a chance to ask her that question because, in fact, I got a hold of her immediately. And she apologized and said that's a national average, but I can't even see that as a national average.
Yeah, I guess
Yeah, it certainly isn't like that. And we actually have graphs on our district page, our budget and finance homepage, that break out our budget categories and expenditures. So there's one on there for revenue sources where we get our funding, and then also the different programs, which those programs are coded uniformly across the state. As far as what's administration at the district level versus school administration, instructional, pupil support in the various categories.
It might be nice if we had a vehicle or a way to maybe state locally what the percentage of our salaries, because, you know, sometimes somebody in a community makes a statement like that and it gains traction in the community because maybe the press hooks onto that or something. So it would sure be nice if we could find a way that we could present locally the percentage of dollars locally, because I don't want us colored by a comment that was made based on some national act.
Right, and so I don't know if you guys want to take the time tonight or not, but we could certainly bring up that homepage and show those graphs so that you would have those percentages or how to get to them, I guess.
Sure.
Would that be helpful?
She does it so effortless.
I know it. It's disgusting.
I know.
A couple times. Okay, so within here we have some narrative on our expenditures and just talking about what falls into the various categories and the percentages that they make up, and then a pie graph showing that. So in the way that we code those, according to Colorado Department of Education standards, is 57% is for instructional programs of our overall expenditures in general fund.
How do we, because I know years ago, we did a study comparatively where we stood with the percentage of dollars that go to, are we still near the top with the amount of dollars, the percentage of dollars that go to instructional services?
Well, I haven't seen any research lately, but I'm sure that we're right at the top where we were. We were within like the top 10 or something, if I remember correct. It's been several years.
Yeah.
But
So the, I was looking at the end of the year general fund budget, and so each one of those categories, it's got instructional programs. Is that's teachers, coaches?
yes, coaches, paras, not counselors.
Right, so on here it says, these categories include costs for all teachers, counselors, social workers, instructional assistants.
Read the websites, what you're telling me.
Going into the
She's reading it
detail,
for you.
classroom supplies, equipment, field trips. So there's any number of individual expenditures that fall within those broad
So
categories.
each one of these line items, I can go on the website tomorrow and know what pupil support services is, general administration support services, all the way down, correct?
Right.
Yep, and they all equate to a pie on this graph of our overall budget.
Perfect.
So if we looked at this graph, basically school administration would be the orange, would that be correct? If I'm looking at this right, I got a real tiny graph here.
Yep. And
Okay,
then
so
school
we could say
administration
that-
would be principals and principals,
Right.
their office staff. Yep.
What about central administration, is that in there?
It is.
I guess the question is, I'm trying to get where Diane has 55, and right now we're at 7.6.
I also think part of the problem with that quote is how you define administration. I mean, you know, like, that could be, secretaries in schools and the principals in schools and the, counselors in schools, I'm
Right, well,
assuming.
especially if she's talking about a national average, because we code ours the same as all Colorado school districts do. So anybody across the state would use these same program definitions that we do, but nationally, each state would have their own way of coding.
Yeah, so national, that's apples and oranges kind of thing. And this ending June 30, 2018 includes the first look at the reorg, correct? We got some of those salaries included in these numbers?
In the first quarter financials, they would be, yes.
They wouldn't be in the June 30th, 2018, no.
Okay.
They would be in the other one that's
Okay.
September.
So this graph is cumulative on the prior budget year. This represents the prior budget year breakdown of,
The graph is
Yeah.
budget, 2018-19 budget.
okay, so it's representative of this year's financials.
Yes.
So I also noticed on some of the special funds, like there's a food service fund, right? And it looks like its revenues fall short of its expenditures. So the revenues is directly attributable to the food services, and where it falls short, that money comes from general fund?
No, it comes out of their fund balance. So each of those funds
Okay.
maintains their own reserves.
So is it still like an enterprise?
It is. So CDE a few years ago made us reclassify it from an enterprise to a special revenue fund, but largely it operates the same way that it always has.
So like it would be similar to what we talked about earlier with the health fund. They operate within the fund specific to them. Food service does the same thing, and they really don't draw from Fund 10 to supplement.
No. So there are a couple funds that have transfers from the general fund into them. Physical activities is one of those funds where we transfer $20,190 each year to help offset some of their costs. Capital projects is in part supported by a general fund transfer, as is our insurance fund. So not our medical insurance, but our risk insurance. The rest of the funds are all self-supporting from their own revenue sources.
So the food, I don't mean to pick on food, but there's a number of funds like this. If the revenues don't quite meet expenditures, and so it dips into reserve, how's that reserve replenished? You hope for a better year, or is that, okay?
Well, for food service, for one thing, is that they get partial reimbursement from both the state and the feds, so that's a piece of their revenue that's pretty significant. But the other mechanism is just the meal prices. Because obviously they have high labor costs for their fund as well because of all of their kitchen staff. And so as their salaries and benefit costs increase, then that's an increase to their expenditures that would need to be offset by some of those other.
Once again, I don't mean to be picking on
No.
food service. They're just one of those funds and one of the first ones in the packet, so.
Well, and to look at food service specifically, so they did use about $100,000 of their reserve, which is better than what they were anticipating in March.
Right.
So in March, they were anticipating to use nearly $300,000, but they still have reserves of nearly $800,000. So we work very closely with Dan Sharp. I know he monitors this, and and Lori King over in that department, that they very closely monitor their expenses and their revenues. So
Feeding kids is good.
It's also highly controlled by the federal government as to what they can serve and what menu items can be. In the distant past, they used to run a la carte, and they could serve Subway and Taco Bell, and high schools generated large profits that offset their costs elsewhere. And when the federal government changed those rules and they had to go to what we're calling fresh menus, our revenue stream dropped, and that's what we're seeing now is an erosion of their fund balance. Dan Sharp's working hard to increase his sales, but part of that is having children change their tastes, habits.
And that's worthwhile.
Right. There
Okay.
hasn't been an increase in student lunch prices in several years.
I really feel like picking on Dan Sharp, though that wasn't my intent. I just want to know what the process was about dipping into fund balance. So, how do you know all this stuff?
I live it every day, John.
Well, thank you very much.
Yes, thank you all.
Yep.
Let us know if there are any other questions as you think of them.
Yeah. We're not shy, we'll call.
You know, an interesting statistic that, I can't help but share in this context of the national, when they start people giving you national statistics around education, they're often skewed very much by large systems. And an interesting one that I always find amazing is, and I've looked it up many times, is 51% of all the students in the United States are in about 16 to 18 school districts. It varies by year based on what sometimes it's 15, sometimes it's 19. But when you think of like the Miami-Dades, the Houston, LA Unified, all of those, just the weight of the system itself to run a system that large, then your administrative costs really do come up. So when someone's looking at national statistics, it's going to skew the results over what your experience might be in a smaller place. So if you're ever on Jeopardy, you can use that one. And then also just in terms of helping people understand the bigger picture of national versus local in Colorado, because Colorado is much more conservative.
My jaw dropped at 55% on local news.
It really wasn't relevant to what that interview is about, though. It's the big
Anyway.
question mark.
I mean, it just kills us.
You're not done yet?
All right, I don't really. Ms. Nikki Jost will share with us the superintendent search process.
Hello. You'll be excited to know that I don't have a presentation. But I have some questions for you. So now that we have Diana on board, our next step is to talk about, do we want to start the search for the next permanent superintendent? So we are at the right time of year if we want to put out an RFP for search firms, and then whatever you want that process to look like, you could interview or hear from search firms to see if that would meet your needs for the next search, or if you want the district to handle that search internally as we did with Dr. Haptonstall.
So we're not obligated to pick a firm off an RFI or RFP. It's a matter of listening to what a firm might offer and the resources it has and what it might cost, and then we can weigh it as a board whether we want to take a go at it ourselves again or use a firm, correct?
That's correct.
Well, I'd be curious to see what a search firm would bring as far as value to this community.
Okay.
Yeah, I think so too, and I think the other thing I'd like to do backroom is talk to Diana, who's going to do superintendent searches. Maybe we can talk to other candidates that we might know personally across the state that are superintendents. And certain search firms, unknown to us, have a better standing than other search firms. So we would be in tune with that as well from a consumer point of view, and then also look at a budgetary point of view, and then as a board make a decision what would be in our best interest.
Sure.
I think we were kind of a receptacle for applications last time, and although I think it was advertised in some national stuff and state stuff, I think this would be a great place to be and work, and I think we should go out and recruit talent to lead this district in the future. And so if a search firm helps us do a recruitment, I'd just be curious to sit in a room and listen to some.
And that's the advantage of hiring a search firm. It's just that their nationwide reach is so much greater than what we would be able to do. And I'm sure both Diana and Scott could add to that as well. There are typically, at least that I know of, 4 search firms that typically would put in some type of proposal and that have worked across not only the United States but also across Colorado.
So I always wonder about, is that a theoretical advantage? So if you take a bunch of schools that use search firms and you take a bunch of schools that don't, who gets the better superintendents? And in the long run, you do better by using local connections of people who know different people and finding, whether it's sort of local or Colorado or Rocky Mountain versus these unknown applications that you get through search firms. And maybe it's great and maybe it's not. I'm just curious what the experience is.
It's a good question, and I've been through both and had both good results both times.
So I think that's a question you ask a search firm that, you know, to convince this board of five that that for the money that the district is going to pay, you're going to do better than what we're going to do otherwise. And so I'm not committed to a search firm at all. I'm curious to talk.
I think that that's a wise approach, is let's listen and put something out there, and then from there you can make the decision.
What are you looking as far as a turnaround to where we'd be involved in work listening to search firms?
Well, Lisa Sharp has already put together some great information, and so we believe we can get the RFP out pretty quickly. And then from there, we would give companies a couple of weeks to respond, maybe 2 or 3. And that may mean a special board meeting at the end of November, if you don't want to wait until the first board meeting in December. But that would be the time frame when I think you could invite in those search firms that you felt were the best.
What would be, if we were to get ahead of the curve on the early hiring, because I know that would be maybe a concern that we would have, what would be that window for early hiring?
You know, superintendent searches typically start a little bit before winter break and really kick in January. And so we would want to have a decision made from the board, whichever way you're going to go, and get ahead of that advertising and get ahead of those other districts that are going to start searching. So we would want to open the position, if we can, before winter break and really do some heavy recruiting during winter break, or the search firm could do some heavy recruiting during winter break in the first part of January.
So the interview process, I'm a lot of times a board member will be part of an interview process over in Lisa Sharp's office on an RFP. I'm assuming, and what my desire would be, is we actually do this as a board of 5 rather than delegate 2 board members to do that. I don't know if that's appropriate or what your thoughts are on that.
Well, if you have, let's say, 4 or 5 companies, you could delegate 2 members to narrow down to the top 2, and then the top 2 can present in front of the whole board, or you could invite everybody in and listen to everybody.
We all trust each other, but not that much, it's just one of those deals.
Okay.
Let me ask you this. So, my preference would be to, as John said, I think all 5 of us to be available for that personally. And then if we go through this process and we don't find a firm or find it's not to our suiting, how well are we set up to do this? I know we did it with Dr. Happenstall, but and I don't, and I know that was a tremendous impact on the crew to do that. But would that be a reasonable thing to think that would be an option for us to go that route? And if so, what other resources would the HR department need? I would assume there'd be some additional people resources or dollar resources that might be needed for that.
Well, the HR department did such a great time with Dr. Happenstall's recruitment in terms of logistics and organizing things, and it was a well-run process, so we're certainly capable of that. I think where we're lacking is that candidate outreach. And that's where that search firm has an advantage over what we can do, because they know people across the nation, not just in Colorado, that may be just perfect for this district, and that a search firm can help also run some community meetings and forums about what the community is looking for. And so they really do lighten the load more so for the board than for the HR department, and we get a wider selection of candidates with the search firm. So that's where we would need some help with community forums, finding candidates across the United States. I think those are the 2 big ones. And I don't know, Diana or Scott, if you have anything to add to that.
I think there are, like you said, even if you chose to do the search ourselves, we can advertise the same way that they do across the country and Ed Week and those kinds of things. But they do have, like, for instance, each year at the National Association of School Executives Conference, they have, booths set up where people who are interested in looking at jobs. So those search firms have an opportunity to really get outreach with a lot of different candidates. I mean, CASB's able to do that as well, but I do think, it's a balance. You will get more candidates, I think, from a national search firm. What's hard to judge over time is, are you getting some that are uniquely interested in just, Mesa District 51, or are they interested in coming to Colorado more general? But that's a great place to begin because they may be able to narrow that down. So as Nikki said, there's a lot of good reasons to go both directions, but I do think you'll cast a wider net with a national firm, but certainly they're modified. And remember, in full disclosure, I'm a search consultant for CASB. I won't be obviously this year, but and I think, they can also access those national networks. They can also do a streamlined version, as do the national firms. So I think the RFP is a great place to begin, and then you can decide from there what you feel like your options are. But at least, I think, as you've all pointed out, you'll know what your options are, which is a great place to start and can't hurt you.
I guess I have a question. If we go, let's say we do go with a search firm, but let's, through word of mouth, we hear there are people interested outside of the realm of that search firm. Do we have the latitude to say outside of that search firm that we want these people included as well?
Oh, sure.
Because I don't want to preclude anybody from the state of Colorado or the nation who's working in the same vein we are to not be a part of that process and be excluded because they weren't a part of this search firm's database.
Of course. And the search firm, if you decide to go with the search firm, they'll sit down with you and say, who's on your list now? Who do you know of? Who do you want us to reach out to? Who are those folks that you want us to pursue and track down for you? So there'll be a lot of dialogue between the people that they assign to the search and the board and what you're looking for.
So how would we get that word out, I guess, ahead of the search folks do? I mean, I guess.
My bet is most people in Colorado know.
I would hope so.
I believe so as well. But that search firm, if you decide to go that route, they'll walk you through what that looks like and they'll direct you.
So I'm inclined to do another meeting in November, and if it's important to have this pushed out before what you call winter break, and we buy a week or two by doing that, I guess I don't want to do one more thing, too bad, but that would seem to me to be a worthwhile thing to do.
Yeah, I agree.
Don't screw up Turkey Day and,
You got it. So what Lisa and I can do is we can work on a timeline for you about the RFP and what some of that looks like. And before anything is sent out, we'll send it out to you via email just to make sure it hits all the marks at what you're looking for.
Okay.
Do we vote on this, or do we just consensus?
Yeah, consensus.
And I think I would remind you that it's your search, so you would have a great deal of latitude and control over the search firm in terms of saying, here's what we want, we want this internal candidate to be considered, or this person we're aware of in another district. And so, and as Nikki said, all of those features are available because every other district has that same concern you do, that you have a strong voice in the process, because you're ultimately the ones who are accountable and responsible.
Okay, great. Thanks for your time.
Thank you.
The next two items, the expulsion report and communication and district initiatives, are in your packet. If we would entertain any questions at this time.
good.
I could just add something on the expulsion numbers. They're down this quarter as compared to the previous several quarters, previous several years. The number of expulsions that we've had.
Which is good news.
It's very positive.
We're trending up for a while.
Yeah, so it's very positive on that report.
Okay, anything else? Okay, on the consent agenda, do I have a motion to approve, we could do this together, I-1 and I-2?
I move we approve the consent agenda, both items, I-1 and I-2.
Second?
Any discussion? Okay.
Yes.
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 Business items, I think, due to the nature of the three business items, it might be worthwhile for us to entertain each one separately rather than a package, unless I hear differently from the,
No, I think you need to do each one.
yeah.
Sounds good.
Okay. So let's go ahead on resolution to support Amendment 73. Do I have a motion to, for that resolution?
I'd move that this board support Amendment 73.
Do I have a second?
Second?
Do we have any conversation, discussion?
Does everybody understand the correction that was in the blue book?
Why don't you remind us?
There was a correction on Amendment 73 in the blue book, and alls it is, it's actually a good thing, that 150,000, 0 to 150,000, 10 years from now, they're trying to have that, what the correction just states that they can correct that to keep the middle class safe from that salary range changing over time. So 150,000 10 years from now may be like what 90,000 is now. And if that's the case, then they can change those numbers in the different
formulas.
Yeah, and just the different breakpoints in that. That's all it is on that. But they're always working to make sure that it's good, long range.
You know, for me personally, as a board member in the past, I've always been somewhat hesitant to, as a board member, to support ballot initiatives. I just felt that was not something I was keen to do. But I think when I look at the many needs that we have as a system and the reality of funding in the state of Colorado, it's pretty apparent that this is a serious attempt to address that. And I do know there are naysayers out there saying, well, this isn't the right solution at this time. I don't know what year Tabor came into, I don't remember the year, 92. But you know, we've been waiting since 1992 for the right initiative at the right time. And here we are 26 years later, waiting for the right initiative at the right time. And I do not believe in the state of Colorado that there's the political will or the political operation that we're ever going to have the perfectly right solution at the right time. And so at this point, I have to say that based on the needs that we have as a system, I don't see any way that we can begin to address the many needs that we have as a system to move forward. I also, as I'm out in buildings listening to teachers and the many issues that they face daily, building administrators, a lot of those issues mean resources. And resources, we don't have any. Basically, the resources, if we're to find great dollars and resources right now, we're going to have to consolidate or larger class sizes or whatever the issues are. And I'm not willing to do that. So I have to put my faith in that Amendment 73 is the right initiative at the right time. And so I'm really going to go against what I have not been able to do in the past as a board member, and that's to support a political resolution as a board member.
Call for a vote.
What are we doing with this piece of paper? Is this attached
That was,
to our
no, that
endorsement
was just
or
information for you, for you personally.
Just me and no one else?
Yeah, just you,
My own personal-
FYI.
Oh, he's got one.
I know.
So let's go
You're
for
not
it.
special anymore. That was from our previous conversation as board members, that people were asking, well, what would this mean? What would that mean? And so as I worked with Vi and Melanie, so as you had questions about Amendment 73, if we were to receive those dollars, what impact could we make with some of the needs we have, and what would those costs be?
So if we do this, that kind of conversation would be sort of a theoretical conversation so that we're not saying exactly, is this
Exactly right.
going to be publicized in some manner, or is this, again, just?
No, it's just food for answer questions that people had.
Okay.
Like, what would that cost if we did this, or what would it cost if we did that? And Melanie and Vi were gracious enough to really put pencil to paper even at the late hour this afternoon. And even though I couldn't do my math very well, we got it all right. And so that's what that is.
Thank you.
Any more conversation or discussion? We'll call the vote.
Dr. Davis?
Yes.
Mr. Levinson?
Yes.
Mr. Kerr?
Yes.
Mr. Fitton?
Yes.
Mr. Williams?
Yes.
Okay, certificate of participation parameters for Mesa Valley Community and Juniper Ridge Charter Schools. Phil, is there anything you want to say before we move forward?
I wrote a note to the board discussing what I thought were the important issues. So if you have any questions on any of those, I'll be happy to answer them.
Motion to approve Resolution J2.
So moved.
Second.
Second.
Call the vote. Discussion? Any questions for Phil or? Okay.
Already asked him.
Or Dan O'Connell, who drove up from Denver, in case you had something to say.
You've had a great time, haven't you?
It sure beats yeah. It sure beats Tuesday night TV, doesn't it?
So why did you come from Denver?
To answer any questions.
He's the bonding person.
He's the money man.
He underwrites the bonds, writes to finance this, what we're doing.
Okay.
He's the guy at the deep pockets. Okay, any other questions? Okay, let's call the vote.
Dr. Davis?
Yes.
Mr. Levinson?
Yes.
Mr. Kerr?
Yes.
Mr. Fitton?
Yes.
Mr. Williams?
Yes.
Okay. The next question would be resolution for water right application at Gateway School. I'm not going to read the resolution. A motion for.
I'd move we adopt a resolution about water for Gateway School.
A second.
Second.
So I do need to tell you the story about this. Gateway School never had any grass, and somebody in Unweep Canyon named Diane said, could Hendricks put in some grass? And so we didn't exactly ask Hendricks, but we went and my buddy Frank Pfeiffer, we figured out how to pipe water from a ditch from across the street and put in, I don't know, a couple acres of grass and a sprinkling system and spent $30,000 of John Hendricks' money. And it was fun. They had grass for the first time. But we never did, it's John Hendricks' water, and it comes from the Bartholomew Hatch ditch, and it's a senior right, but we never gave any to the school district. We just kept it. So this year they had a call on the water because it's so dry, and they got a ditch rider that said, you ain't taking any water out of that ditch, and no matter, you got a nice pump and you got a nice pipe, but you can't have any. So it's a solution that the principal down there came up with. They're just going to throw a pump into West Creek, and they don't have a very senior right, but if there's water they can pump, and it's their own. So it's a good story.
Well, that's the right thing to do. Any other comments? Call the vote.
Dr. Davis?
Yes.
Mr. Kerr?
Yes.
Mr. Fitton?
Yes.
Mr. Williams?
Yes.
Board open discussion, anything that we need to touch base on?
I have a question about why the business, we go through this really long meeting, and then the business items are the things we're voting on, and maybe they're always just a slam dunk, but we're all like exhausted. Well, I am anyway. So why do we have those so late? Because it's great to have these presentations, but if we're going to have discussion, it's like, well,
I'm tired, yeah.
How many questions do I really want to ask right now at 25 after? But, the responsible thing is to make sure that we do have discussion about the business items. And I've been doing this for very long, so maybe we're all discussioned out because it happens in the last meeting. But why do we, is there,
I don't know, do we have flexibility in determining the agenda order, or is this something?
The answer is, to her question, is because we always have. So we could put it.
The presenters would like to present first. That's, I think, part of the answer.
Part of the answer is the community people
yeah, I get that.
don't have the patience of Dan and.
Can we pay attention to, if we know we're going to have something that may need discussion, that we are sort of have that on our radar, and if there's going to be something like that, to move that up so that we're not.
We can amend the agenda.
Yeah, so it could be on a case-by-case basis, and tonight, I don't know that we needed to move anything up. But we could potentially have something where we're all going to argue.
Well,
We haven't yet, but we could.
So when we go to the agenda approval, we can make a motion second and have a discussion. And if we feel, that a member or two feel there's an issue in the business section that needs additional time or conversation, then we can vote to amend the agenda and move it up.
Okay.
Well, we had talked before as well, you brought it up a number of times, Tom, and the agendas have been what they've been. This is my third year, and they're all important presentations, so I'm not pointing that out, but to Amy's point, if there's significant items that we need to discuss and talk about, maybe some of those presentations are put at another time, if that's possible, as opposed to, like you said, that with the budget. I mean, all due respect to Mel and Vi, I mean, that's kind of a quick thing, and maybe we should delve more into that, or you talked before that, maybe that's what the meeting's about, the budget, particularly from where we've come. But I would agree with Amy, is be more.
So I also want to comment a little bit about issues that we're seeing in schools as we go visit. And I loved the presentations tonight. You hear about SWAP, and you never knew about SWAP. And so you hear about a facet of this district that people are just doing wondrous things. And listening to Melanie talk about budget, I don't know how you know all the stuff you know when questions are answered. But we also have some issues that I think would be important just to talk about as a board. We hear about testing at elementary schools and workload of teachers. I mean, the list goes on, and I think when we get together from all our discussions, we're going to find we got 5 or 6 or 7 things that sort of resonate through a lot of schools. And so I'd like to carve out some time at board meetings to have more of a conversation, and maybe get some teachers in here, some principals in here, rather than someone giving us a really polished kind of presentation and talk, dig a little deeper. In that regard, one of the things I'd really like to do is, I know that MVEA has a workload committee with teachers, and they presented to us a couple of years ago, and it wasn't a very fun thing to listen to, but you don't know about it until you hear about it. So I think that's one thing we might be able to foist up on agenda pretty quick. I think also Dr. Circos talked to all of us about the need or the thought about having some sort of retreat. And I think a half a day talking about a lot of these issues and maybe giving Dr. Circos some direction collectively would be a good use of our time as well. So anyway, that's a suggestion for the next meeting, but also kind of float that out there and see if we can put something on the calendar.
I like the idea of the retreat too, and I think maybe if we wait till the end of October and we're through with our school visits, and then we can come with our comment cards and just sit around and have a conversation about what were we hearing, what are the big issues that we've discovered as we've gone around, because I doubt that any one of us, I mean, we probably have an 85% agreement on most of the issues. I think there's individual ones that might be site-specific that we run into once in a while. Yeah. But I think after we finish the school visits, let's find a half a day and let's have a good conversation about the issues that are out there, because a lot of these issues unfortunately mean resources of time or resources of people, we need to have the conversation.
And these talks, I think, I hope you all agree, but these talks with teachers have not been gripe sessions.
No.
I mean, they've really been, we're really happy that you're here, and here's a piece that's really not working. And so it'd be fun to tackle it. I hate to spend any more time, but.
Yeah. I'll chime in and I get my on this, but I would concur. Nikki brought up that we're in a time crunch in a way for looking for a new superintendent. This is a prime time to begin that process and when that needs to roll out. And I would contend that as a board, I'll back up a little bit. There was a nice article that Kelly Flanagan presented in the paper, and I wrote her an email about that, and I said, it's important that our community understands that, and we've been very clear about that, the bond and mill money has been used specifically for those items, but the items that come up so much in these teacher visits, without exception, and from elementary to high school, has been about the salary issue, about the position, the additional positions, workload, as we've talked before, the inverted pyramid, the top-downness of where we find ourselves, or at least many people in schools are. And so I think a couple things before we hit, at the latest, the end of the semester, we need to have, as a board, a clear voice to our superintendent about here are the issues we need to look at long-term, and to give our community internally and externally where we all fit. And I would agree with Tom. I think we're probably all on the same page where we are on this, but we haven't had a chance, and we've been busy with thank goodness hiring Diana, but to begin to look at that. We can't kick the can down the road and get to Christmas and haven't discussed this, because I think our community wants to know this, our teachers, our staff want to know where do we stand on this. And I have a couple visits more this week, and I know that's going to come up, and it does, and we need to come up with an answer. And we can't do that unless we talk, and we don't get a chance to.
Exactly.
And to Amy's point, when you get at 8:30 at night and we've been busy all day, that's not the time to have that discussion, so I'm not doing that now, but I would agree that a retreat is as critical as anything we're going to be doing over the next couple months to give our community an understanding, at least where the five of us stand, and what direction we feel, because we're representing our community, and we were all voted in to do that.
Well, another thing that came around in another conversation is, you have the retreat now, let's talk about the issues, let's come to some focus and direction. I think have another retreat second semester with some clarity and resolution of the issues that we brought forward. Where are we as a system in addressing those issues, and what's happened because we've had these conversations and we've identified these issues that need to be addressed. What's happened within the system to address the concerns?
Mm-hmm. I don't want anybody to think we aren't thinking about it, or that we're pushing it ahead, because we aren't, and we can't.
I've been to enough schools where there are some definite big rocks that are starting to form, and with that, there's some serious needs out there we need to look at to help schools.
Any other comments? Future meetings, I think everybody can look at those. I know that on your own personal calendars, you've got future meetings at schools and that, and Diana will get back to us as far as a retreat date and time. There's no need for an executive session, so.
I'd move that we adjourn this meeting.
Second.
I don't want to adjourn without this. Diana, it's so great to have you on board. I'll tell you, I know you've been out and about and walking around, and one of the things I've heard in our meetings in the last week is we've done well, very well in selecting you. So thank you for being here.
Yeah.
Thanks. It's truly my pleasure to be here.
Okay, call a vote.
Dr. Davis? Yep. Mr. Levinson?
Yes.
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 Yes. So.
Yes.
A couple things. There have been times where we've added
resolution items, also in the superintendent's report. It's an item you want to discuss before going to
You know, when we do agenda setting, maybe we can have some of those conversations, and if we feel there are big issues, we can.
Okay, also on your rescheduling of schools, we need to see if we have other members to possibly cover that.
Do we know which date?
Okay, Tom had a couple dates he couldn't cover on schools.
Because they were too close together where I
They
can
were
do
too
it.
close together, I don't know which they were.
Why don't I talk? I will. Oh, here it is. No, I'll talk
One
to you.
other item for, is the reply card you guys get from the schools?